Sponsored by St. Elizabeth Healthcare.
There's a new heart study shedding new light on a genetic condition that often impacts young athletes.
Health anchor Liz Bonas talked to experts about it today, and she joins us now with what they want all of us to know. Liz.
Hey guys, good afternoon once again. The team at St. Elizabeth Healthcare and the Heart and Vascular Center talked to us today about this study just released from the European Heart Journal. They looked at information from a huge data bank in this study, which tracked people for years with a condition called cardiomyopathy.
Is a disorder of the muscle heart that involves the structure and function.
Dr. Mohammed Sanu specializes in this disorder. He says as cardiomyopathy gets worse, patients often need emergency care. The heart can become enlarged, thicker, or rigid, and it can't pump blood through the body. But in this study,
they found that 40% of them would have an inherited disorder. They also found that those patients are at increased risk of having arrhythmias or sudden cardiac death.
Sometimes, he says, we only hear about this happening in patients when, for example, an athlete has a cardiac event on the court and passes out. But now Dr. Sanu says this shows genetic testing might tell us who's at risk. Part of what this does, he says, this information now invites a new conversation. If this is in your family, then should you have genetic counseling, genetic testing, follow-up treatment, and care?
So patients who have a cardiomyopathy, if you identify 2 or more patients in the same family who have a cardiomyopathy, then you're going to have to shift your thought process to say, listen, this patient might have an inherited disorder that's causing that cardiomyopathy. And at that point, you should initiate family screening.
That family screening usually involves interviews, blood tests, sometimes electrical tests. It's not one thing. And what this helps us do is you couldn't screen the general population. Lots of times with athletes, we want to do that with conditions. Yeah. We'd like to, it's just expensive. But this would tell us who to screen and maybe narrow down and prevent some of those deaths early on.
All right.
And it may happen, they think, in athletes because of the adrenaline surge. You know, there's something that's going on in the body there, and that would maybe give us some insight. We might be able to treat them, and we might just be able to
follow. Doesn't seem like a downside either. And sometimes if you don't want to know certain things, but this doesn't seem like a downside.
No, this is one you would want to know. Yeah, there are certain times where you say, what would you do with the information? If you had this information, you could get the right care, get the right follow-up, and perhaps the right intervention, which is critical.
Good.
Yeah.